Cystic fibrosis is an inherited chronic disease. It also causes lungs to clog, which leads to life-threatening lung infections. It also obstructs the pancreas, which causes natural enzymes to stop breaking down food and the body to stop absorbing food, which is called malabsorption.
Cystic fibrosis is caused by a mutation on the 7th chromosome. A person must have inherited 2 copies of cystic fibrosis gene to have the disease. For example, if 2 parents who are carriers for cystic fibrosis, which is when someone has 1 gene for cystic fibrosis, have kids, they have a 25% chance of having a child with cystic fibrosis, a 25% chance of having a child that has no cystic fibrosis gene, and a 50% chance of having a child that is carrier for cystic fibrosis. Cystic fibrosis causes mucus to build up in a patient's lungs. This can prevent the movement of germs and other harmful organisms from inside the body back out.
Cystic fibrosis causes sweat glands to stop sweat from being absorbed back into the body. This causes the sweat to sit on the skin. This gives the skin a salty taste.
Lung infections are caused by the clogging of the airways that leads to inflammation in the lungs. This causes difficulty in breathing and doing physical exercise. Due to malabsorption, the disability of a body to absorb nutrients, the body doesn't get all the calories for energy that the body needs to grow and develop.
Cystic fibrosis causes many problems with the way that patients breathe. Patients will often go through coughing fits, which can include phlegm. They may also have wheezing at times and shortness of breath. If a person shows symptoms of cystic fibrosis, or if a baby has a positive newborn screen for cystic fibrosis, a doctor may order a sweat test. This simple, painless test is the best way to diagnose cystic fibrosis. It measures the concentration of salt in a person's sweat. A high salt level indicates cystic fibrosis.
All U.S. states require that all newborn babies be screened for cystic fibrosis. If the screening comes back positive for cystic fibrosis, the babies can benefit from early diagnosis and treatment. This can change the baby's growth, lengthen their lifespan, decrease the time spent at the hospital, and keep their lungs healthy. Genetic carrier testing is when a doctor tests the patient's blood to see if they have the gene for cystic fibrosis. If they do, they are considered carriers. A carrier is someone who has the recessive gene for a characteristic but does not exhibit symptoms of the disease because another dominant gene covers it up. In the 1950s, few children with cystic fibrosis have lived long enough to go to elementary school. With developments in medicine, the lifespan of cystic fibrosis patients has increased. Patients are now living, on average, to be in their early 30s. In some cases, though, some patients are living to be in their 40s, and a few lucky ones have made it to their 70s. Along with living longer, cystic fibrosis patients with continuous therapy can now lead more normal, healthier lives and even participate in sports and other activities. They must follow plans personalized for their condition to further this development. The diets that cystic fibrosis patients follow must include certain foods. These foods are usually high-calorie and high-fat foods. They need the calories to make up for the nutrients lost to malabsorption. The high-fat foods are needed to fuel the otherwise minimal growth and weight gain. Doctors also prescribe pancreatic enzyme supplements. These are pills taken orally that provide enzymes to help the body digest food in the intestines. Cystic fibrosis can also predispose a patient to other illnesses and diseases. Patients are advised to avoid people with colds, the flu, or any other contagious illnesses. The flu is more dangerous to patients with lung diseases, like cystic fibrosis, because they can develop more serious cases of the diseases. Patients can also contract diabetes because of cystic fibrosis. Cystic fibrosis leads to scarring in the pancreas, which can cause it to slow or stop producing insulin. Kalydeco is a pill for people ages 6 and older who have the G551D mutation of cystic fibrosis. It is meant to help thin the thick, sticky mucus caused by cystic fibrosis that builds up in the lungs so it is easier to cough out. There are many ways for a patient to clear their airways. One way is called postural drainage and percussion. Patients can also use inhaled medications and also antibiotics. Postural drainage and percussion is where the patient sits, lays, or stands in a position that can easily cause mucus to free up when the patient is clapped on the chest or back areas. Inhaled medications reach the airways quickly and easily. One inhaled medication is an aerosol. These are mists made from liquid medicines. Another is a nebulizer. During this, the liquid medicines are put into a cup, which then has a machine shoot bursts of air through it, causing the liquid medicines to turn into a mist, which the patient can inhale through a mask. Mucolytics is also inhaled and thins mucus so that it can be coughed out easier. Toby is a widely used antibiotic that can be effective against the most common source of chronic lung infections, a bacterium called Pseudomonas aeruginosa. Hypertonic saline is used to draw more water into the airways and make it easier to cough out the mucus. There are many different kinds of antibiotics. There are inhaled antibiotics, which are antibiotics that are inhaled and reach the airways directly. Intravenous IV antibiotics, which are given through an IV, which gets the antibiotics directly to the bloodstream. And there are oral antibiotics, which are pills, liquids, or capsules taken orally. Lastly are implanted devices. These are devices which are inserted into the body for permanent or long-term use, and for quick access to a patient's bloodstream. These devices can prevent a patient who is expecting many shots or IV implants from having to get stuck each time, and prevents the nurse from having to look for the vein every time. A port, shown in the picture, is an example of an implanted device.